This is a Jet 24, Fox 66, your Erie.com special report.
Good afternoon. We interrupt our programming to bring you a special report, as we do every Wednesday, an update on the spread of COVID-19 in Erie County. Let's go live now to the studios of WQLN, where Erie County Executive Kathy Dahlkemper is standing by for her weekly update.
Good afternoon, and thank you for joining me today as we update you on COVID-19 pandemic here in Erie County. I apologize that Mark Blakeney, our interpreter, had another work obligation today, which took him out of town at the last minute. We look forward, of course, to seeing Mark here again next week, and we are working on trying to find a substitute that may be available should Mark get called out again on work. Hopefully we can make that happen. There are 21 new cases to report as of late last evening, which brings us to a total of 1,694 cumulative cases since March. Erie County has had 122 new cases in the past week. So as you can see, this is no time to ease up on what we know works: wearing a mask, keeping your distance from others, washing your hands frequently, and staying home when you are feeling sick. 147 cases are currently active. 1,495 have recovered, and we have 52 deaths reported in the NEDS database. Of the cumulative cases in Erie County, 56% are female and 44% are male. Regarding race and ethnicity of our total cumulative cases, 65% are white cases, 19% are African American or Black residents, 7% are Asian, 2% are other, and 7% are unknown. Regarding Hispanic origin, 6% are Hispanic of any race, with 83% non-Hispanic and 11% unknown. And today we're doing the breakdown of the total cases by age in the last 7 days to show the trends, but you can still find the full cumulative list at eriecountypa.gov. So in the last 7 days, we've had 3% who are ages 0 to 4. No individual positive cases ages 5 to 9. 11% are ages 10 to 18. 28% are ages 19 to 25. 23% are ages 25 to 49. 24% are ages 50 to 64, and 11% are ages 65 and older. So as you just heard, the highest percentage of cases in the past week are among those residents who are college age. I urge all young people to keep in mind that although they may not get severely ill from COVID-19, as we know, they can easily pass it on to their family, their friends, their loved ones, their grandparents, their aunts and uncles, the people that they care most about, those particularly with compromised immune systems. We've seen it already in our community where older adults were exposed and contracted COVID-19 through contact with young family members. So please, all of those listening, please be responsible and be mindful of your loved ones when you go out and do the activities that you do. I now want to invite Charlotte Behringer, the Director of Community Health Services at the Erie County Department of Health, to share an update from the Health Department. Char?
Good afternoon. Thank you so much, County Executive. As we can see, Erie County cases are definitely on the rise. As was stated, an age group with a large number of cases is that 19 to 24-year-old age group. This group includes the majority of our university students. The 3 local universities that are holding in-person classes are Gannon, Mercyhurst, and Penn State Behrend. Each of these universities started discussions with the Health Department back in the spring. As soon as they started planning for fall classes, they started talking with us. They've gone to great lengths to accommodate the physical distancing guidelines and the governor's masking order that is in place. They have each set up space on their campuses for isolation and quarantine of their students, and they know how to use it appropriately, and they are using it appropriately. They have a good they've actually altered their schedules so that there is no longer a long break in the middle of the semester where students would typically leave campus and then come back. They have trained contact tracers, and they are actually conducting the tracing related to those college campuses and any of those college activities. We as a health department do perform the contact tracing for any of the contacts that are community related. Thus far, the majority of the contacts have been directly related to the university campus, the university activities, not general Erie County contacts. Each of these universities maintain very regular communication with us here at the health department. Now, related to contact tracing, to have successful disease control actions in Erie County, we very much need the cooperation and the honesty from the persons that are identified with COVID disease when they are asked to identify their close contacts. Reminder, a close contact is someone who has been within 6 feet for 15 consecutive minutes or longer to someone with COVID disease when in the time frame that they could actually spread disease. We've seen several instances recently where a newly identified person with COVID disease tells us at the health department that they were a close contact to person X. We go back and look at person X's contact sheet, and these new cases were never identified as contacts. What happens when these cases aren't identified and quarantined, when the contacts aren't identified early and quarantined, we have more community exposure to disease because they were not quarantined when they became infectious. Please help us protect the community by sharing all your contacts with the contact tracer when you are asked by the investigator. The other thing that we see, unfortunately, is that there are more group events occurring, social activities that are held without respect to social distancing or masking. In the last week, we had a situation where a group of people rented transportation, went out and visited various points of interest in Erie County. They were all in the closed vehicle for several hours without masks or physical distancing. Currently, 8 out of 12 persons in that group have contracted COVID-19 disease. We understand that we all want to get back to some sense of normalcy in our lives. Please, please, please think through these activities and how they could be accomplished while still keeping in mind the distancing and the masking guidelines that need to be implemented to prevent the spread of this disease. We're going to have COVID disease around for a while. We need vaccine before it's going to go away. We are in this for the long haul. Please, we ask you to think about your behaviors and how they impact disease control in our county. Thank you so much.
Thank you, Shar, and such an important message as we see these numbers climbing to levels we haven't seen in a long time. There are quite a few health department positions open at the county's career page. So if you are qualified and interested in helping with the fight against COVID-19 in Erie County, I ask you to apply today. You can go on eriecountypa.gov and hit the careers button and find out about these positions. As you can only imagine, our contact tracers, our disease investigators, and truly our whole team is very, very busy right now as we see this surge in cases in our region. The health department has been doing quite a bit of work in partnership with all of our local schools, and I today am pleased to have John McEnroe, the Erie County Safety and Training Coordinator, with me. He's currently assigned as a school liaison for the Erie County COVID-19 Pandemic Response Team, and as I said, he's going to provide us with an update today. John?
Thank you, County Executive. Our collaboration with schools dates back to the early spring. At that time, we were assisting school districts in their decisions during the mandated shutdown in how to hold graduation ceremonies and things like that. Since then, we've developed a very effective working relationship with school districts and especially superintendents and their pandemic teams. School districts have been forced to make some very difficult decisions, and in many cases, they've had to make these decisions with limited guidance. I can say from personal experience that each of the superintendents have made decisions with the primary concern being the safety of their students, staff, and faculty, without a doubt. Some districts, they've experienced the effects of COVID-19 firsthand. They put a great deal of time and effort into their individual responses. And this is evident by the number of conversations and meetings that we've had with each of the districts. The districts have all been very consistent in sharing information and in their compliance with state guidelines and every recommendation that the Erie County Department of Health has made. I know some of their decisions are not popular. I sympathize with them in having to make these decisions. And I also know they don't enjoy making some of the decisions they've been forced to make. No matter what decision they make, undoubtedly there are going to be some that question those decisions or find fault because those decisions don't align with their perspective. Just keep in mind, it's easy to question or doubt or find fault in their decisions when you're not the one tasked with that significant responsibility. In recent past, some of the clusters that we've seen, they're not necessarily the result of any failed procedure or process that a school has in place. In many cases, they're the result of an activity or an event outside of school. And then when those students come back to school, that possible exposure occurs. So I would ask everybody, please help your school districts by following all the guidelines and guidance that we've seen consistently over the past several months. And then work with your school district in doing everything that you can do to help prevent any additional disruptions to our kids' school year. Thank you very much.
Thank you, John. Thank you to you and your team. You've been doing a phenomenal job, and I want to thank particularly all of our school districts, particularly the superintendents and the administration who's been working with John and his team. It's been a great partnership, and I honestly don't know of another county in the Commonwealth who's has such a great working relationship with their school districts as we do. Another step we have taken is to explore ways to better reach our underserved populations here in Erie County, and we're pleased to announce that Erie County has engaged a public relations firm to work with local community groups in conducting a major study designed to determine how best to communicate COVID-19 related health and safety messages to these underserved populations. Stevens Strategic Communications is helping us to determine who is best able to resonate on a group-by-group basis to ensure no group is overlooked here in Erie County, regardless of ethnicity, ability level, and potential language barriers. They are conducting media, community leadership, and healthcare. They are contacting media, community leadership, and healthcare institutions. If you are interested in having your voice heard around this issue, contact the COVID-19 study team at mrodriguez@stevensstrategic.com. Again, that's mrodriguez@stevensstrategic.com. On another note, if you have downloaded the new COVID Alert PA app, you will now be able to get notifications on your smartphone if you've been exposed to COVID-19 when you travel inside New York State, New Jersey, and Delaware. I encourage you to download that app at the Apple Store or the Google Play Store. Over 250,000 Pennsylvanians have downloaded the app since its launch. We also had a great conversation this past week with the Second Harvest Food Bank to talk about food insecurity, especially as we go into the fall and winter months. If anyone listening or knows anyone who you are familiar with who has issues around food insecurity, there is a number you can call, and they will hook you up to a local food bank in our Erie County region. This food bank, the Second Harvest Food Bank, actually extends way beyond Erie County, so if you're listening from Warren, Crawford County, or any place beyond within our viewing area, you can also call this number. And it is 814-459-3663 and hit extension 117. So that would be 459-3663, extension 117, if you are having issues with food insecurity, and they can help you. And then finally, I'm pleased to share with you the information today regarding the Erie County CARES Act funding. For the Erie County CARES Act Nonprofit Assistance Program, notifications went out yesterday, Tuesday, to each one of those organizations, 104 in total, that have been granted $4,270,510 in total. The grant awards ranged from $2,000 to $100,000 per organization. We have 12 arts, culture, and humanities organizations, 8 community capacity organizations, 21 education organizations, 8 emergency response organizations, 4 environmental or animal-related organizations, 10 health organizations, 29 human service organizations, and 12 religious institutions. So as you can see, we've been able to help many of our great organizations through this funding. For the Erie County CARES Small Business Assistant Grant, we were able to help 181 small businesses, and they have been granted a total of $5,725,000. And these grants are ranged from $5,000 to $75,000. So again, helping so many of our small businesses who are struggling through this pandemic. For the Erie County CARES Municipal Reimbursement Grant Program, 17 municipalities are receiving just under $399,000, just under $400,000, $399,725. And so those municipalities are also getting very much needed funding to help them with their response to COVID-19. And for the Erie County CARES, what we call PPE, Personal Protection Equipment program for small businesses, we had 85 applicants who will now receive 118 of these PPE kits. And applicants will be contacted by the Public Safety Department to schedule a pickup sometime in October. And back to the Small Business Grant Program, those businesses were notified today via email. The actual list of awardees will be placed at eriecountypa.gov by the end of October after the grants are processed by our Finance Department. Each organization will be notified directly via email, and a check will be out to them as soon as they fill out their paperwork. Thank you to everyone who has taken the time to complete the application process, and congratulations to all the awardees. We hope that this funding helps you shore up your businesses and your nonprofits during this very much unprecedented time. Now, I would like to turn it to the media, and today we'll start with Erie Times News. David, are you with us?
Yes, Kathy, thanks. I just wanted to talk with Shar for a minute. I wanted to make sure I'm clear on the cases among the college-age people. Shar, did you say that these are mostly on-campus activities? And can you elaborate a little bit on that? I didn't hear that part very clearly.
What I was saying was that most of the contacts to the university cases are contacts that are located on campus or are enrolled in campus studies. In other words, not community at large contacts.
What types of activities are we talking about? Are they small gatherings that are going on? And what's been the response from have you talked with the college people since these cases have been spiking a little?
We have very regular conversations with the university pandemic contacts. It has varied. Some of it has been sports. Some of it has been group activities.
And is it spread out among all the local universities, or have you seen it primarily at one or two of them?
Oh, no, it's spread between all three of them.
All three, okay. Counting Barron but not Edinburgh, correct?
Edinburgh is a huge majority online.
Right, okay.
Thank you, David.
Thank you, Shar.
We'll now go to Erie News Now.
Hi, Paul Wagner, Kathy.
Hi, Paul.
What worry or concern, if any, do you have about the easing of the capacity restrictions for sports and other events that was recently announced?
So the announcement by the governor yesterday for events uses a percentage base. Prior to that, it was 25 indoor, 250 outdoor in terms of those attendees. I actually think a percentage base is a better way to go. You could take a let's just take an outdoor event. You could have the patio outside of the convention center, and you've only got so many square feet, or you've got a big football stadium, which is much, much larger, and you could probably have safely more capacity in that football stadium than you could on that patio. So this is why I believe the state went to this, and they actually cited on their website under their facts that they have the science to back up their decision to go with a percentage versus going with that specific number.
Thank you.
Sure, Bob. Talk Erie. Joel?
Thank you, County Executive. This question is for Shar. Shar, can you comment on the rise of cases, especially in the last week or so, and the actual hospitalization rates, which are actually some of the lowest in the last several months?
I think it makes sense that the hospitalization rates are lower because we're seeing so many of our cases in younger populations and not in the 65-plus population where most of the hospitalizations have occurred. What was the first part of the question, Joel?
Well, yeah, just a follow-up. Are we to kind of understand then that that these are like those simple courses of disease where it's kind of like that 7 to 10 day exposure and then they come out of the symptoms, or is there a full range of different how much these young people are getting sick, I guess?
Certainly. Okay, it has ranged from persons who had no symptoms whatsoever, they were just identified on surveillance that was being done by the universities, to persons who have really become quite ill, not necessarily having to be hospitalized, but really not feeling well for a number of days. To my knowledge, almost all of them have been released from isolation after the usual 10 days.
All right, thanks so much.
Thank you, Joel. Jet TV.
Hi, Kathy. It's Star. This question is for you. Are you concerned about these campus activities or even college sporting events that this could be relating to these COVID-19 cases? If so, do you think that these types of activities, extracurriculars, should be canceled?
I think everyone needs to be very diligent, no matter what activity they're involved in, about wearing their mask, about keeping socially distant from each other. I was talking to a group yesterday. It was a college class I was on Zoom with, and I said, if you play a sport, I know how difficult it is to actually be on the court or on the field and wear a mask, but as soon as you come off of that field and you're on the bench, say if the defense goes on and you're on offense, for example, a mask should be put on, and the coaches all need to be leading by example, wearing a mask properly over the nose, over the mouth, keeping 6 foot apart, and the same with the fans and the support for the teams. So I think that everyone needs to really rethink, am I doing everything I possibly can within these activities to keep everyone as safe as I can? Again, the contact, as Shar said, is a 15-minute interval, so I guess if you're just running by each other, it's very minimal contact, but when you're standing on the sidelines, it's usually for a while. So I think, again, thinking about those parameters, we want to keep children in school. We want to keep our college students at college and learning if possible, but if the numbers continue to grow and the situation becomes worse, then I think the schools will have to think about how they continue to function. And so that's what we've always been trying to avoid from the beginning. Let's keep our businesses open. Let's let our kids go to school. Let's let our colleges finish their semester, and all of us have a part in making that happen by following the guidelines.
Thank you.
Thank you. We'll go back to you, David. Erie Times News.
Sure, Kathy. And this one's for you and Shar, whoever wants to answer this one. So going back to the college-age cases, other than strongly encouraging students to mask up and to be socially distant, what can the colleges do? What are there steps they can take? Are there steps they're going to be taking right now that you've discussed with them in the last few days that they can do?
I'm going to have Shar answer that first, because she may have had some specific things that she's talked to them about.
Yes. The universities that have the on-campus classes, they have gone to great efforts. They've done all the 6-foot spacing between the desks. They are basically mandating the mask use on university campus and have set up very positive ways to reinforce this with the students. So they're really on the ball. It's really hard to control the behavior of people, let alone 19 to 24-year-olds on a college campus. Sometimes there have been severe warnings put out by the universities to some of their students with some of the activities that have occurred. Again, that's up to each university campus how they choose to address those concerns.
And I'll just reiterate sort of what Shar said, that what I've seen from the visits I've made to some of the college campuses and the conversations I've had, I think that the administration in those schools are really trying their best. You have a congregate setting, people living together, people eating together, people socializing together. It's always going to be more dangerous when you have people brought together. But again, we are trying to have some sense of normalcy in our daily lives, in our weekly lives. But we do need everyone to remember this virus is out there. It wants to find its next host. It will find it if it has the opportunity. Masks work. Science has shown that. Social distancing works. Science has shown that. We've got to continue doing those things as much as we may not like it.
And just to follow up, Shar, with these college-age cases, these are primarily through contact tracing. You're finding out this is mostly outside of the classroom, outside of some of the like the cafeteria and places like this. Are these happening after school hours?
That we do not know. The contact tracing for the universities is done on campus by the universities. We are only tracing the ones that are not related to the campus.
Okay. Thank you.
The one additional thing I will say about this was brought up from the staff today is, many of our college age, and these numbers are not all in college, but there are many of the people who have to go out and work in some of our service industries. And so again, the risk for all of us in the community and for this spreading to other age groups that may have more of an issue with this is always high. And so again, a cautionary tale for our entire community to do our best to protect yourself, protect your loved ones, do what you need to do. If you feel uncomfortable in a situation, get out of that situation and go home. Erie News Now.
Yes, Kathy, Paul Wagner again. There was a few weeks ago a lot of concern on the part of the health department that people would wanting people to get their flu shots, worried about a convergence of COVID and flu. Are people getting their flu shots and the numbers that you want to see?
I'm going to ask Shar to answer that.
Flu vaccine is readily available this year. It's readily available through the pharmacies. LECOM Health is running their community campaign, as is normally done. They state that they are getting a good turnout also. It's important. We know that distancing and masks will help decrease the amount of flu, but we want to do everything that we can to prevent co-infections. Flu and COVID are both lower respiratory infections that have great potential to have great complications if they happen together. We really want to prevent that as much as we can.
It's pretty easy to get a flu shot these days. If you have insurance, you can walk into pretty much every pharmacy in this community, and they have the flu shots there. Many work sites are doing flu shots, so please take advantage of that soon. Thank you. Talk Erie.
Yes, I have a question for John. I wanted to ask you, John, regarding the trade-offs of the disruptions, again, in changing modalities of teaching, of whether it's in-person class or hybrid or all remote, based on what most people would say on face value is like a single % of cases within a population at a school. Can you walk us through that of whether, having 1% of your student body getting COVID or active cases is enough to change modalities with that being so disruptive?
Well, I can say that any change in the mode of instruction, there's going to be an impact, and an impact that's probably going to be felt more by the students than anybody. In terms of the decision-making process, that has been placed on the superintendents, on the school districts by the state. So again, they've been put in that position to make those difficult decisions, and I empathize with them on that. Now, one other consideration, if you take two different school districts with, a big difference in population, 1% could be a lot in terms of numbers for that highly populated school district, where 1% in a school district that doesn't have, higher numbers wouldn't be as many. So there could be a potential variance there in the effects felt. But again, I think the goal is follow all the guidelines, do everything that we've been told to do in previous months, and prevent that, or at least try to limit that change of instruction model as much as possible.
Just a quick follow-up, John. It's been told to me by several school administrators that they follow the amount of community spread within a particular county very, very closely, because that's indicating, what modalities should be engaged. Have you seen any districts anticipating a change in modality based on this kind of rise that we've had in the last couple weeks here in Erie County?
Specifically, no, but what I can tell you is the superintendents, the school boards, they're looking at several different data points on a regular basis to make these extremely difficult decisions. The work Char's done is unbelievable. And if you think about her team, they had their hands full prior to schools opening. Schools opened, that in effect doubled their work. And she is in constant contact with the pandemic coordinators and superintendents to talk specifically about data. And it's not just one piece of data that's lending them the information to make a decision. They have to consider a bunch of different things.
What would those be? Can you name a couple of them off?
Number of cases in their district, and I'm talking about specifically in their school, cases in their community, not only confirmed or probable cases, but when you start looking at the close contacts, if a district has 2 bus drivers, a couple folks that work in the cafeteria, and 5 or 6 teachers that have to quarantine, that could limit their ability to effectively provide in-person instruction. So they have a wide range of areas and information that they have to assess prior to making these decisions.
Thanks so much.
Thank you. Jet TV, Star.
Yes, hi, Kathy. This question may be for Mr. John or Shar in regards to the campus and the spike in cases there. Are any of these coming from the dorms or those who live in the sorority housing or the fraternity housing? Is that where we're seeing a spike, or is it just everywhere?
Shar?
Yes, I'll take this one. It has actually been a combination of on-campus housing, off-campus housing, and I can think of at least one fraternity that has been affected. So it's been a combination of a multitude of living arrangements.
And once they found out that they were, if it was a fraternity or those off-campus apartments, college apartments that have 5 or 6, 7 people living in them, what are the precautions and what are they doing to make sure that they're disinfecting? Is the university coming in to step in to help, or not necessarily?
When it's on-campus housing, yes. When it's off-campus housing, they have a good understanding of what it means to isolate and to quarantine folks. If need be, sometimes folks are moved around so that it's not quite as long a quarantine for the housemates. If it's a group of 5, one is a positive case, the other 4 would have to quarantine for a minimum of 24 days. get through that person's isolation period, add on another 14 days. So they work very hard at moving people so that their kids have the least amount of time with instruction being all online versus in person.
Thank you.
Thank you.
David, do you have a final question from Erie Times News?
Yeah, actually, on a slightly different COVID-related subject, Kathy, I want to get your thoughts. While we're seeing a spike in cases this week, we're seeing a reduction in rate among cases in the 16503 zip code. Just want to get your thoughts on the efforts in that zip code and how they apparently have paid off, and can what's been done in that zip code be used in other zip codes that are seeing a spike in cases?
That's a great question, and we are very, I think, happy with the work and very proud of the partners who've worked alongside the Erie County Department of Health to reduce the numbers in the more urban core. They have set up testing, as we know, at the neighborhood centers on a weekly basis. Anyone can go and show up at those centers and get tested. Lots of information was passed out through dropping it right at people's doors and through social media and other methods. So I think in the end it's really paid off in terms of severely and extremely well in terms of bringing down the caseload in that area. We would like to see the ability to go into other zip codes, other census tracts when we see those kind of cases rise like that. We are actually using some of the CARES Act funding that the county has received to acquire a mobile unit. We've been using the neighborhood centers for this particular effort, but we don't always have that kind of partner out there. So this mobile unit could be deployed to a certain area of the county if we saw a spike in a community somewhere or in a neighborhood somewhere. And so as soon as we get that mobile unit in and up and going, we will be glad to be able to send that out as we as we've had these partnerships show the success here in the urban core. Thank you.
Thank you.
Sure. Paul, Erie News Now, do you have a final question?
Yeah, final question, Kathy. You talked about the money for the CARES money for the small businesses, the 181 small businesses getting the $5.7 million. You said they were notified today. A lot of these businesses are really desperate. How soon will they actually get the money?
Well, they have to fill out some very minor paperwork. This is all done through a portal that we have. You have to sign an agreement. We have to set them up as a vendor through our finance department. But we are working diligently through the finance department to get this money out as quick as possible. So I can't give you an exact timeline on that, but we expect it'll be fairly quick turnaround as long as the businesses quickly turn around their end.
Weeks rather than months?
Oh, yes, definitely weeks. Definitely weeks. My goal would be to have all this money out before the end of the month, and way before the end of the month. So I know the finance department is working diligently on trying to do that. The municipalities, I believe all those checks have already been cut, and they're working again. They have to wait till the paperwork comes back from either the nonprofit or the small business to set them up as a vendor, and then we can cut the checks.
Thank you.
Sure. Talk Erie. Joel, do you have a final question?
Yes, just one for you, Kathy. Talk about the felt need behind engaging this PR firm to communicate with the underserved populations. You just went through the race numbers, and they seem to be really balancing out. And of course, David mentioned how 16503 is doing better. Where's the felt need here, and also how is this getting paid for?
It's getting paid for through the CARES Act funds, so there's no county dollars, tax dollars going to this. And when we say underserved, it can be lots of groups underneath that. You know, just as we talked about having this mobile unit, we want to hear like how are we not reaching the people in the more rural areas? How are we maybe not reaching our college students as well as we could? How are we not reaching certain segments of the population? And the message and the way that we communicate to these entities, these groups of people, is probably going to need to be different. So it's not just about new Americans, it's not just about the urban core, but it's about the whole county, and how do we have messaging that would resonate with the different groups as we tend to see some spikes. How do we better communicate with our 19 to 24-year-olds? It's a different communication than it is with the 60-year-old segment. So that's what we're working on, and I think we're going to have a nice product out of that that then we can use going forward, because we all know this virus is not going away. It's going to be with us for many, many more months to come, and we have, I think, a very potentially rough winter in front of us, so we need to have this ability to communicate as need be.
Thank you.
And Jet TV, final question, Star?
No, thanks, Kathy.
Thank you. Well, I'd like to take one last moment here to address our restaurant owners. Only 173 restaurants in Erie County of the nearly 1,500 restaurants that are licensed have registered for the self-certification, which would allow them to move their capacity to 50%. For those residents who want to see which restaurants have that certification, you can go to Open and Certified PA Business Directory online at pa.gov and find out which restaurants in Erie County have that certification in and are allowed to go to 50%. They also will have a sign that's been given to them by the state, and the capacity level will be listed on that. So if you want to go out and check that website first before you go out to a restaurant, please do. Restaurant owners, remember, this is free, and you still have the opportunity to certify, and I strongly recommend that you do it as soon as possible. And this leads me to my star players. Let's talk about Virgil's Pizza on 6th Street, West 6th Street. You have to order online. Pickup is outside upon your arrival. They are actually not allowing any indoor seating at this point. Tootsie Winkles, a children's resale boutique on West Ridge Road, has face masks required. Spacers on the floor and displays are spaced out to avoid overcrowding. And finally, Rent-A-Wreck on West Ridge Road. They take all payments, insurance, and information over the phone, and they meet the renter outside when picking up the rental vehicle. So thank you, as always, to all of our businesses who I know are striving every day to keep Erie County as safe as possible. And lastly, there's been a little bit of a change in the 2020 census. The count has now been extended again to October 31st. The response rates in Erie County are 73% at this point, and 65% of the City of Erie residents have responded. You can again go to my2020census.gov or call 844-330-2020, and there will be census employees available to help people complete their census at Larry's Central Market on Sassafras, Thursday through Saturday this week from 10 a.m. to 2 p.m. Please, please, if you have not done your census, I encourage you to strongly to fill out that census form. When we talk about the CARES Act dollars that came to Erie County, it was based on the census of 2010. So these dollars and dollars in the future really are contingent on people actually being counted. So lastly, with all of these high numbers, I want people to not be afraid, but I want people to use the knowledge that they have to keep themselves and their families safe. We know what to do. We know we need to wear our masks when we're outside of our home and around others that we don't live with. We know we need to keep 6-foot distance from those we do not live with. And we know we need to wash our hands frequently and use hand sanitizer. If we continue to do, and if we aren't doing, start doing those things, we will control this virus in Erie County. So in the meantime, please stay as close to home as possible. Please remember to stay safe, and as always, stay calm throughout this pandemic. Thank you.
And once again, you've been watching this week's update on COVID-19 from County Executive Kathy Dahlkemper. In case you just joined us, here are some of the highlights and updates today. There are 21 new cases in Erie County. There have been 122 new cases, she said, over the past week, and reminded everyone now is not the time to ease up on what works concerning masks and social distancing. 147 cases are active. They broke down the numbers this week, though, in terms of age of the positive cases, in terms of the 122 new cases over the week. The highest percentage, 28% in the age group 19 to 25. They cited the majority of the new cases are college age, and that most of the contacts are with college activities and not community spread. There's also a lower hospitalization rate, they said, obviously, because of the lower age of the positive cases this week. The other age group coming in rather high, 23%, ages 25 to 49. They said, too, in terms of the colleges, there's gatherings are to blame. There was actually an event they cited last week where people were traveling throughout the county together, going to spots in a vehicle together. 8 of the 12 people who took part in that tested positive, just to kind of give you an idea of how quickly this can spread. They also wanted to remind everyone that if you are newly identified positive and you're contacted by the county health department, you need to be honest about your contacts, because they've had issues where people are not being 100% honest about the places they've been or the people they've seen, and that's crucial in order to let other people know that they could have been exposed and that they should take precautions. They also mentioned today that the CARE Act grants have started to go out, notifications at least that people have received those CARE Act grants. In terms of nonprofits, 104 were awarded. The total is more than $4.2 million to 104 nonprofits in Erie County. In terms of small business grants, 181 grants were awarded, totaling $5.7 million. She said that yesterday emails went out to alert the nonprofits that they will be receiving that money. The small businesses should have gotten those emails today. There's some paperwork that has to be done in terms of getting that money distributed. So that is good news for area nonprofits and small businesses. Also, too, they were talking about the schools and mentioned that the school leaders, superintendents are closely monitoring data in terms of how school will proceed. Reminding them if there's clusters in their particular school districts, they're keeping an eye on that. Also, as the county executive said, everyone in terms of increasing attendance at events where the governor has upped those numbers in terms of percentages of capacity. That starts this Friday. She said as long as people follow the guidelines, she agrees with his decision. And again, everyone saying to follow the guidelines, which are wash your hands repeatedly, wear your face mask, and practice social distancing of at least 6 feet if you need to go somewhere. We'll have a complete wrap up tonight on Jet 24 beginning at 5 p.m. Have a good afternoon.